Heterotopia, arrested neuronal migration with ectopic gray matter nodules or band-like areas, periventricular germinal zone to cortex, often asymptomatic but can be seizures, focus, must distinguish from tumor, temporal and occipital horns, congenital, acquired, example maternal trauma, infection, toxin, heterotopia. This is the pictures and in which show the multiple small nodules, bands, periventricle germinal zone to cortex, match gray matter signal, lack enhancement, lack calcification, margin may be indistinct mass like mimic tumor, subendymal heterotopia, and the arrow shows the disorders and subepidermal diffuse nodular heterotopia. This is the pictures and band heterotopia, double cortex thick, deep to thin, seizure risk more than 19% in girls, band heterotopia, heterotopia and in which associated anomalies, Javelgar syndrome, paroxysmal syndrome, disorders, abnormal migration, hypomyelination band, heterotopia, agenesis, Chiari 2 malformations, Dandy Walker spectrum, and organization syndrome, superficial cortex and whole cortex. Superficial cortex in which focal cortical dysplasia without balloon cells, whole cortex in which polymicrogyria and schizencephaly. Polymicrogyria, cortical dysplasia, irregular cortex with numerous small convolutions and shallow or orbit-treated sulci, late migration and organization, unequal distribution of final migrating neurons, 20 to 24 weeks, dearrangement of 6-layered lamination of cortex, polymicrogyria, 2 patterns by degree of myelination, more than 12 months, thin, small, fine undulating cortex with normal thickness 2 to 3 mm, less than 18 months, thick bumpy cortex 5 to 8 mm, hypomyelination, cortical infolding, irregular indistinct outer and inner cortical surfaces, shallow flat sulci, small isolated unilateral to bilateral, predilection for pyrisilvine region. Polymicrogyria, thickened cortex with nodular surfaces and irregular gray-white matter interference.